is the story of Nolan and Jack Willis, 15-year-old twin boys living in Syracuse, New York, who are also diagnosed with a rare genetic disease by the name of Duchenne muscular dystrophy, or DMD for short. But like with all stories, it's important for us to start at the beginning. For instance, what is DMD? Duchenne muscular dystrophy is a rare muscular disorder, but it is one of the most frequent genetic conditions affecting approximately 1 in 3,500 male births worldwide. What causes it, you ask? It all starts in the X chromosome linked gene for the largest protein in our body, dystrophin.
People know that they have DMD in the first place. For starters, a doctor would want to do a simple blood test where they specifically look at the molecule creatine phosphokinase. A healthy level, for example, would be no more than positive result would make your doctor a little suspicious. Folks with DMD, though, these levels are significantly elevated, reaching an average of 30,000. The next step would be genetic testing, where experts comb through your DNA to
Right now, there is no cure for DMD, and many boys sadly don't live past their 30s.
For many boys, like Nolan and Jack,
however,
this
one
is
of
the
the most
stage where they
recent
are
controversial
unfortunately
successes
diagnosed with
was the
this rare
conditional
disease.
approval of eteplirsen, a drug developed by Sarepta to treat DMD and that Nolan and Jack actually participated in during its clinical trials. In the previous lack of treatments for DMD, eteplirsen was understandably the most anticipated drug for many patients and their families. And while this is definitely a success in improving the quality of life for people like Nolan and Jack, another battle is still being fought, specifically towards the drug's accessibility.
Backtrack for a moment and talk about what eteplirsen actually does. Developed by Sarepta, this drug is meant to reduce the severity of DMD by controlling the mutation through exon skipping and allowing people to produce a mini version of the dystrophin protein, leading to a much milder disease called Becker's muscular dystrophy. In the past, the only main form of treatment available for DMD were steroid injections, which were costly in and of itself. Coriana Litchford, the mother of 7-year-old Logan Litchford, who similarly is diagnosed with DMD, echoes this sentiment over these steep costs. Logan is on $200 worth of medicine, in particular, a bill that is tough for this family to swallow has been criticized for using a weight-cost ratio to sell their steroids, which was mistakenly marketed to be cheaper than the selling rates for other companies. The reality is that the ratio PTC Therapeutics was using could actually be more expensive and could reach as high as $89,000. So when news of eteplirsen and its therapeutic benefits reached the ears of these same families, many felt hopeful that an alternative drug could be put on the market to surpass these expensive steroid injections. What they didn't anticipate, however, was the reactions many medical insurance companies had towards the money needed to cover the drug. Eteplirsen alone is actually estimated to cost more than any previous treatments, measuring at approximately $1 million a year per person.
Because of this, many medical insurances have decided not to cover these costs, a consequence that can be traced back to the controversy surrounding the drug's approval in the first place. The problem with eteplirsen C is that during its clinical trials, which our twins Nolan and Jack participated in, researchers couldn't say with full confidence that the drug could effectively treat DMD. Because of this, though, the FDA granted it conditional approval on the basis of an act that was passed in December of 2016 and went by the name of Cures Act. What is the importance of this act, you ask? Well, it essentially called for the accelerated approval of drugs designed for life-threatening diseases. However, what good is speeding up the process to get a drug into the market if both pharmaceutical industries and medical insurance companies combined render it almost physically impossible for a vast majority of those who need it the most?
For the few medical insurances that do cover it, too, patients must be found eligible first. For example, at one point, an insurance company by the name of Premera Blue Cross established that coverage would be provided but only if patients underwent a muscle biopsy. The caveat here was that muscle biopsies were an extremely invasive, painful procedure which must have been added to deter those under its insurance from requesting coverage. Other companies like United Health and Humana require that patients still be ambulatory or be under 14 years old. What does this say to DMD patients, then who have waited for this drug the longest, only to find out they are denied the opportunity to use it? Especially on the basis of something they can't control, the progression of their disease or their age.
So where does this leave Nolan and Jack? As of right now, the twins are fortunately still receiving eteplirsen as a part of the clinical trials they continue to participate in. However, as their mother anxiously puts it, she does not know how long that will last.
The main focus for these patients, their families, and the DMD community should be on the innovative steps to treat or even cure the disease. But in addition to the struggles of facing and living with this fatal disease, adversity comes with financial pressures and the harsh reality of the system surrounding the development and market of these drugs.
Created using Powtoon.